Hi, everybody. This is a recording that I owe you. This is pertinent to the lab. Uh, I will load these PowerPoints for you on Blackboard. And I'll just put a label like muscular system. But this is not the physiology of muscles. We do that in physiology. This is the anatomical basis of muscles, that you can see here. And there's 4 PowerPoints in this particular series that I find useful, but it's really about highlighting the major muscles. If you're going into career in physical therapy, if you're doing physician's assistants and you're working in orthopedics or rehabilitation, I mean, it depends on what you're doing. You get more information. And particularly at a graduate level, you get more information. So effectively, we're focusing here on skeletal muscles. You can see, believe me, in physiology, we'll talk plenty about cardiac and skeletal. We're going to even do some cardiac muscle in lab because we're going to dissect the heart. So these are the idea. The part that I don't do is the leverage part. That's mechanics. You can look at if you're confused about it. These are the various kinds of levers, first, second, and third degree levers. Uh, to me, that I'm not interested at all in that. But Dr. Buxton would be happy to help you. I'm confident. So again, muscles. The idea is you're contracting a muscle, so effectively you're pulling something. It doesn't mean that you can't push with it if you exert a force that's effectively pushing out your arm, but effectively it involves contraction. And effectively, we always have groups that we have called an agonist and antagonist relationship. The prime mover, and unless otherwise specified, these are flexors. Powerful muscles are generally flexors. I say it again and again. Flexors overpower extensors. Until you see that repetitively, I talked about that with regard to stroke, when we talked about that ever so recently, just the other day. So the major responsibility for the we call that the prime mover or the agonist, and inevitably it's a flexor. There's some oddballs, obviously, if we're not talking about flexion and extension. The antagonist is opposite. So even in powerful muscles that occurs, so you have the biceps of the arm flexors, biceps brachii, brachialis, and they're opposed by something called the triceps brachii. Even though they're all powerful muscles, the flexors overpower the extensors. So opposite sides in the joint. So it's fairly easy. We have helper muscle synergists. Okay, same movement. Okay, and that's where biceps brachii would be the prime mover. The brachialis would be a synergistic, even though it's a powerful muscle of itself. And then sometimes you have to have a stable base, and that's what they call fixators. So I'm not going to point these all out, but from a definitional standpoint, this is what it's all about. The mail finally came. It's 4 o'clock in the afternoon because of the holiday yesterday. For example, this is a prime mover. It's interesting. They're powerful muscles. This is pectoralis major. If there's a major underneath it, there's a minor. And it's not that the minor is unimportant. It's just not as powerful as this. It inserts, it flexes, as you will see, the arm here because it doesn't insert into the head area by those tubercles. It inserts into the shaft. And that attachment means that its action is not on the shoulder, more on the arm, is the way that it would be defined anatomically. So this flexes the arm on the torso, brings your arm forward. It's opposed, as you'll see in the back, by something called the latissimus dorsi. People refer to them as their pecs and their lats. And the latissimus dorsi is a monstrously strong muscle and attaches posteriorly to roughly the same area on the shaft of the humerus, and it opposes it. And so that's effectively that is where this is the flexor, that would be the extensor. They work in concert. We really see them looking, we can really see the definition. Get a chance and watch competitive swimming. If they have Olympic trials or national or world championships, look at the swimmers. Boy, do they use these muscles. Because particularly this is for if you're thinking of the crawl, effectively what we call freestyle in swimming, that's really the muscles you use extensively here. Swimming is a great exercise because it uses all your muscles. And here's the opposite, the lat. Posterior side, extensor. So they're a classic example of the arm on the torso, extensor and flexor. And that's how you have to express it. And this is abduction. We always say adduction and abduction because add and abduction sound too much the same. So you're moving something away And I undoubtedly I will do this anyway when we get into lab on, or even with doing it with joints. When we get into lab next on Monday next week, though, I want to focus on something else. Probably I'll do it in lecture a little bit, is to understand that this is something. It's basically pulling your arms, like bringing your arms up from your sides. That's abduction. You're moving your arms away from the midline. Adduction is moving them toward the midline. And we usually use and emphasize the letter when we're pronouncing it because it avoids confusion. You hear that a lot when we talk about afferent, which is incoming, and efferent, which is outgoing, because afferent and efferent are hard to distinguish. Little things that you do in science, and particularly in medicine, to avoid errors. And adduction would be going the opposite way. Here they're showing you the teres major. Teres means round, by the way. And it's interesting. This is a pretty good, strong muscle that'll pull your arms effectively from behind, almost crossing them behind your back a little bit, if you want to think of it that way. And there's a smaller one called teres minor that goes up into the posterior aspect of the humerus. Actually, that, because it's into the head of the humerus, is part of the rotator cuff, even though it's not a particularly powerful muscle. Just understanding the naming in this. And so all of these, prime mover in one, antagonist for a different, synergist for a third. We look at these. So some muscles can do all of these simultaneously. So how do we name them? Where they're located: pectoralis in the pectoral area, the chest area. Okay. Temporalis by the temporal bone, frontalis by the frontal bone. Okay. Any of those types of things. Its shape. So you saw the deltoid is more triangular in shape, because like the Roman letter, when we do the formal Roman letter for delta, basically a triangle. And if we have multiple ones that are similar, even if it's just two, we talk about their size: maximus, minimus, longus, brevis, which would be shortest. Okay. If there's two, we name three. Sometimes we use the term tertius. So these are, if you go into this in great detail, and again, it's a career related type thing to look at all the muscles that are there. In my field, because we were all lower extremity, we knew all the names of all the muscles. And I mean, and there's 620 muscles. My gosh. Fibers. Rectus means straight. So there's a really important one. And so, and all of these are your abdominal muscles. They're so important. So you have the rectus abdominis. That's the one that's based on what we call an aponeurosis. It sits on sort of a cross between a ligament and a tendon. And it's very, very firm, strong, dense connective tissue. And the muscle actually attaches there. So it appears that we're seeing a group of muscles. It almost divides the muscle into 6 subunits, and hence 3 on each side, hence the name, the six pack. And that comes from the rectus abdominis. And we'll see that when we look at the rectus muscles. Transversus abdominis is actually relatively weak comparatively. It's almost like comes across like a belt, but a rather thick belt that would be there. Okay. And these are straight. Transversus runs perpendicular to it, right angles to it. The oblique run at an angle. So you have external obliques, which are the strongest of all the muscles, and internal obliques. So when you hear about a football player last night in the game, because I had him in my fantasy team and he had to sit out the game, the tight end for Buffalo, and I looked up and go, oh, great. He had an oblique strain. And that happens in football players. That happens in baseball players a lot. That particular muscle, abdominal muscle, and it's really painful when you try to do anything. You really can't. You just have to rest it. And again, more than 2 heads is really where it is. So 2 origins, 3 triceps. There's even a quadriceps, as you'll see in the lower extremity. And they call them origin and insertion. Really, the attachment is a much more. So you can think of proximal and distal, superior and inferior, medial and lateral. Okay. So they're named by the attachments. The mistaken notion of origin and insertion is that the origin is the big place where it attached and it's moving it from. So, I mean, take the biceps brachii. You're doing a curl. I'll buy that. So you got a couple of weights and you're doing a curl. You're flexing your forearm upon your arm. But if you're doing a chin up, that's really the fixed point and you're pulling up your torso. So it's working from what would classically be insertion to origin. So attachment, in this case, that would be a proximal and distal attachment. It attaches on that radial tuberosity on the radial bone is where the biceps brachii attaches. There's a whole list of these. I'm not going to ask you to know all those. I'm trying to give you some context. My guess is from an anatomy perspective, this would be something I would put in a packet and name them or identify what group they're in, that type of a situation. For me, I'll probably, and frankly, I'd make it take home because, I'm not there hands-on teaching it to you. More like a glorified homework assignment for lab. So the muscle action they produce, flexor, extensor in this particular case, and again, where they work. This You see flexor carpi ulnaris. It flexes the wrist in the ulnar direction. Flexor carpi radialis in the radial direction or lateral direction. Remember anatomical position. All of that's part of it. And then they do the fibers. And this is sometimes the naming. So there's different patterns. Most of the time they do converge. Sometimes they're just long parallel bundles rather than going from wide to narrow. That would be more convergent. Pennate derives the term because they look like a pennant that would be flying like a small flag. And circular is self-explanatory. I don't do all of those. They'll show you the examples. They're interesting. So convergent, that all the fibers are convergent in the pectoralis major. The biceps brachii fusiform means it's narrow here and wide in the middle. That's what fusiform is. So obviously, when you contract it, it bulges in the middle. And that's what somebody works out, and that's a good muscle definition. You'll see that. Circular is just that. And so they're described. This is called the orbicularis oris. You have another one called the orbicularis oculi. They're circular muscles that help you close your mouth and close your eye. And so those are really two, and they're facial muscles. And if you want to give it some additional room, and I was going to do this nugget in lab, I just wasn't up to it yesterday, was to talk about the innervation. I'm going to do the innervation when we start looking at different muscles and we start looking at what, for instance, what the supply is of what's called the facial nerve. That's the seventh cranial nerve. It's really important. And basically all of our muscles of facial expression, which this is one of, are innervated by it. So whether you're closing your eyes or closing your mouth, it has to do with the orbicularis oris, oral for mouth, and oculi. And so and here you can see the locations. Here's parallel. By the way, this is the longest muscle in the body. Muscles aren't nearly as long as nerves. So a typical muscle fiber, an individual muscle cell might be a meter, not a meter, might be, 30 centimeters long, more like a foot long would be this. This is a little bit longer than that. So it's multiple fibers that were in there. We'll get into the definitions when we look at physiology. But this is parallel. All the fibers are going in the same direction. It's a strap, would be the best way. I would describe them as strap-like muscles. Okay, and here you can see, here's this grouping, but they had sort of a pennant shape, so they called it multipennate and bipennate because there's two of them, or unipennate, which there's one of them, and I don't care. But this is where they're located. That sartorius is really a neat muscle. And it goes, and this is where the anatomy, if I made a point, and again, at a graduate level, you make this point. The reason you have a spine on the ilium, you have what's called the anterior superior and the anterior inferior spine. You have on the posterior as well. This goes from the anterior superior spine, the uppermost front edge point, where there's a little elevation on the ilium, all the way down to the medial portion of the knee. So it crosses the hip and it actually goes to the knee posteriorly. So it flexes the hip and it flexes the knee. So it goes over two joints. Yet it's a flexor where now here, that anterior inferior spine is right below it. That's the rectus femoris, okay, which you can see here. It's got the two bundles and it goes from the anterior inferior spine and it becomes part of what's called the quadriceps femoris, four muscles that join together into a common tendon called the quadriceps tendon that envelops and the patella forms within it, and then a ligament goes into the tibial tuberosity, famously the patellar ligament. That's the knee jerk ligament. And so here someone have a quad injury right there. And I've seen quadricep tendons tear. Oh, that's nasty. And the structural weak point, everybody, is here on any of these. The structural weak point is typically what's called the myotendinous junction, particularly in the Achilles tendon. Most of the tears occur where the transition zone, and it's not abrupt, it's more gradual than this, is the transition between muscle to tendon. It's not super sharp, but right there is typically where we see ruptures of tendon. Again, it's less likely to be the tendon, so to speak, because the tendon is more of a rope, just all connective tissue. It's transitioning from one tissue to another. Okay, and the same thing, we see a muscle tear. They're much more common than quote unquote tendon tears in that regard. Maybe the Achilles is the most common, maybe the quadriceps. And again, biceps tendon is different because that rupture is it's being pulled out of its groove, as we were talking about when we talked about joints. So here you can see some of these, and they give you examples. That's great. And you just go over the same stuff we just looked at. They're there, blah, 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 blah. And the penates don't care about all this stuff. And they look at the fascicles are the little bundles of muscle cells that are there. And the fascicles really play a pivotal role. When we get to analyzing what muscle looks like, you'll see what fascicles are when we look at the muscle itself. Cross-sectionally, again, that's more in physiology. Okay. So, I mean, if they're long, it's short, it's actually better than long. Okay. Power depends on the number of fibers. A fiber is actually an individual cell. Okay. And that's where we look at these powerful, but they're not nearly as long. That sartorius, it's a strong muscle, but it's not nearly as strong. And say if you go back and look at the other ones that they were talking about, when you start looking at some of these others, it's long. I mean, this rectus femoris is a stronger muscle. And this is where they do the leverage system. And God bless you, go look at it. Okay. I mean, if they're showing you, this is I would have thought. I said leverage. That's what I thought. Put a stick under it and lift a stone. And here, the effort, the fulcrum, the load, boom. Who knew it was a teeter totter or whatever, a seesaw? Okay. So first class lever, fulcrum is between load and the effort. Seesaw, scissors. Yay! And you're just showing you these different things. Wheelbarrow for second class lever. There you go. Third class lever. Elbow. Oh, great. Don't not my strong suit. This I'm a little stronger here. So again, when they say greater than, rather than giving you an exact number, there's anatomical variations. People have extra little slips of muscle, and we look for those sometimes surgically when you're trying to, because they're extra. It's like spare parts. The body comes with certain spare parts, and you can use them without affecting function. You can use them for grafting. You can use them for coverage if you have to eventually do skin grafting. You can't just put skin on top of nothing. You got to have something. You pull a piece of muscle down or graft a piece of muscle from somewhere else, and then you can do skin grafting on top of it when you deal with ulcerations. It's interesting stuff. Okay, and so all of this types of, all that type of stuff. So classically, you would name the muscle, you'd name the origin and insertion, you'd name what it does, you'd name what nerve controls it, and what its blood supply is from. That's classic medical school anatomy. This is what we did. Now, I have I've seen this taught. I had a student oh my goodness, we did this. Like our teacher told we had to learn 20 muscles with that. Who cares? Memorizing 20 muscles doesn't make you have an understanding of muscles. That's why I'm not fond of this necessarily. I want you to know the muscles. If you're interested in it, examine them more rather than me playing name that muscle. And I certainly wouldn't go into all that jazz with origin and insertion and innervation and blood supply, but that's traditional learning with regard to it. I like to know what they're involved in and what their general role is. Okay. And sometimes you can name it pretty easily, as you can see for this. And this is it's a different class, but it's the beauty of people always say, "Well, how can I? You got your own cheat sheet." I mean, I remember that happening. I'm doing an exam in in med school in my basic anatomy course, and I'm feeling myself up, for lack of a better way to express it. I am all over feeling for stuff, and all of a sudden I hear a teacher, see what he's doing. I'm like, oh, I'm in trouble now. No, he goes, that's the best. the best cheat sheet anybody ever had. That's what you're supposed to do. It's like all of a sudden, he thought I knew something. But nevertheless, I probably didn't. These are very busy, and you can blow it up if you want. Okay, and increase the size of it. And you're going to look at here. These are called muscles of facial expression. The muscles you chew with, called the muscles of mastication, not the same. Then you get torso muscles. These are, and again, axial and appendicular. Most of these muscles are axial, and some are connectors between the axial and the appendicular. Pectoralis major, deltoid, be examples of that. So there's a lot of really significant muscles, and again, and they're large, and so it's easy to see. These are the hamstrings, very famously. These are the gluteal muscles. And there's three of them. People make that's a big error. So they say, well, you get an injection, your gluteus maximus. Very rarely, because the gluteus maximus is covering the largest, thickest nerve in your body, the sciatic nerve, and you can damage it. So injections are given up here. It's more of a hip as opposed to a buttocks. Okay, and that's typically in the gluteus medius. So the nursing majors learn to palpate, to feel by surface landmarks and create little triangles with their fingers. I wasn't taught to do this. I mean, we basically just knew, okay, you don't give it, you give it here, and you showed us, and you see one, do one, and teach one, which I'm fond of saying. Here's that big lat or latissimus dorsi. These are your traps, or trapezes because they look like a trapeze. Deltoid because it looks triangular. Okay, these are some of the muscles that make up the rotator cuff. The infraspinatus being one of them. Again, that infraspinous fossa that I pointed out to you on the exam. So all of those are, and you'll see a lot of these muscles. Hamstrings here, there are actually 4 muscles, but they have 3 names because one has 2 heads. So medially, you have semimembranosus because it looks very membranous when you dissect it. Semitendinosus because it looks like the tendons kind of run up like little strips of tendon, sort of interestingly before they can join into one. And then laterally, you have 2 heads, the biceps femoris. Those big, you can feel them behind your leg. Those big, what we used to call leaders. Those are the hamstring tendons, and you generally it's that when they're high. I mean, you can feel a hamstring. You might irritate it here, but when it comes up under your butt, and you end up, oh my god, those are ones take a long time to heal. Just for example, and these are the 2 large. They're called, people erroneously call them gastrocs. You can call them that. Okay, but in classic anatomy, they're called gastrocnemius. So they are the medial and lateral heads of the gastrocnemius. Underneath them is a massive, thick muscle called the soleus. Think sole of your foot, heading toward the sole of your foot. And they come together to form with bands of fascia around them, the very famous tendo-Achilles, Achilles tendon, or tendo-calcaneus, because it inserts into the calcaneal tuberosity posteriorly. And there's a little ridge there. Just this is, you can go crazy with this stuff, and a lot of people do. They love this stuff to be able to do that. So we divide them into these regions, and that's really what I talked about. Now, some of this is easy. For instance, the muscles of facial expression, which are, and I'll show you the exception of the chewing muscles. I mean, and we use them all the time, and their difference is they insert into skin, not bone. So they come from bone, but they insert into the skin, whether it's pursing your lips to whistle, whether it's blinking your eyes, whether it's smiling or frowning, whatever you're doing with that. And that's nonverbal communication. They're all innervated by the facial nerve, and they use a Roman numeral 7. And they're all innervated, and they're all nourished by the facial artery and its branches. See, that's easy. And you learn when you do circulation, which we'll do probably about 2 to 3 weeks. When we do circulation, that the facial artery is a branch of what's called the external carotid. And there's like 5 different branches. We don't go into all the crazy with all the branches, but it extensively innervates the face and the head and the neck in a variety of areas. And so facial expression, they have scalp muscles and facial muscles, not a big deal to me. For instance, in the scalp, when you wrinkle your brow, you have the frontalis and the occipitalis. Those 2 muscles basically are known classically are the epicranius. And basically the idea is, as you can see, facial nerve, raises the eyebrows, wrinkles the forehead skin, blah, blah, blah. You'll see it. It's there. I mean, this is just an example of what they are. Oops, a big part. Oops, sorry. I'm on my computer at home. And so they're showing you a prosected section. So this is the frontalis area, okay, over the frontal bone, and the occipital area here. What this is, these are called aponeuroses. So the aponeuroses, again, is this unique kind of, it's soft tissue, but it's extremely dense. It's dense, irregular connective tissue that's almost a blend of tendons and ligaments, but not nearly organized exactly the same. And in a lot of areas, the plantar fascia, which you hear so much, like a bowstring across the bottom of the foot, the nuchal, the ligamentum nuchae, and if you're cooking and you work with a big slab of muscles called silver skin, it's just so you got to cut it off because you can't digest it. It's just ugh, yuck. It doesn't do anything for you. And so we see that, and it could get like the definition of the six pack. That's what these are. So there's a number of these, and I'll point out where they are. And there's a number of these, and a lot of them are very important. There's a band that runs between the ilium all the way down to your tibia. And it's called the iliotibial band. And a lot of muscles anchor to that and sort of help to hold, and that anchorage helps to hold the fascia. This is another layer of connective tissue that holds your muscles, let's say, to your thigh, and then subsequently to your leg. And athletes get something called iliotibial band syndrome, which is a mechanical defect, either from their leg position or foot position or thigh position, whatever sports that they do. That's where all these things interrelate. And if you're interested in this, great. Then you follow it up and wherever you're going. So here I was showing you the prosected specimen. So here they are. Now the ones that are not part of this, the temporalis is a chewing muscle. It goes from the temporal bone and it inserts, okay, into that coronoid process on the maxilla. This, okay, and so here from the zygomatic arch, you have something called a masseter bone that goes all the way down to the angle of the jaw. Those are your major chewing bones. We call them the muscles of mastication. So even though they're on the diagram, they're not part of the same product. The other two muscles attached to those pterygoid plates, and those pterygoid plates, medial and lateral, you have two little projections coming from each one of them. Those processes, have muscles that go to the interior portion of the mandible, and those are the medial and lateral pterygoids, is the name of those muscles. Those are your side to side grinders, protruding the jaw, retracting the jaw, etc. That's part of the muscles of mastication. So, for instance, so we'll get to those in a second. And you're going to see, like, for instance, you have a smooth muscle that's over your neck. It's not part of this group. It's called the platysma. And that's easily seen in dissections. And there's this giant muscle called the sternocleidomastoid. And sterno means it comes from the union of the sternum, from a part of the upper portion of the sternum. Clavicle, cleido is for clavicle. Okay, and mastoid, that mastoid, big process behind your ear. And again, I put a lot of these I put on the test for a reason, for the bones practical for a reason. And that's true. That muscle allows you to move your head side to side, making no bend your head. It's extraordinarily powerful. What you're going to see uniquely with the human body is that muscles are massive and thick posteriorly. Their job is to hold up your head. And the muscles are relatively delicate, covered by the platysma anteriorly. And indeed, when we have to do surgery, okay, on a cervical spine or in this area, the approach is not through these muscles. They're massive. They used to be. It's much easier to go anteriorly because you can carefully move vital structures like carotid arteries and jugular veins and the trachea from one side to the other. The esophagus, you can move those things in such a way that you can go in there and access what you need to do. So it's a really important point to understand that, this is sort of the interesting thing about anatomy. We see you can deduce things from the anatomy and then sort of extrapolate to the physiology. Holds up the head, for instance. It's there. So here you see these different muscles. And I used to have students label this zygomaticus from the zygomatic arch and the zygomatic bone, really into the upper area around the mouth. So think of, a big grin when you pull your lips up. Sort of, it's almost like widening your smile, kind of thinking about that. The buccinator is a cheek muscle, relatively tiny. People used to think as part, erroneously, oh, this is a muscle of mastication. It's kind of pursing your lips and whistling. But effectively, why it plays a role in eating is that it helps to obviously center the food in such a way that it's more easily chopped up. In other words, mastication chewed in that way. And here you can see the orbicularis oris. Risorius is sort of an angle. That's sort of more of that grin muscle, not so much wide, but up. And then depressing the lips, sort of frowning, elevating the lips. So you see depressors, levators. Yeah, I mean, this is sort of moving your eyebrows, corrugating, or sort of, like a corrugated box, meaning sort of wrinkling your eyebrows. So this gives you an idea what they are. That's all. There's a nasalis, undoubtedly, to wrinkle your nose very much. A mentalis, that mental area, again, don't know why they named that. So those are just some of the things that are there. But these big muscles that you'll see, and I don't make a big deal out of them because I'm not, it's like the splenius capitis. These are large muscles in the posterior aspect that play and they're innervated differently. So this is the facial muscles. That muscle is a facial expression. She's showing you all of this. The muscles of mastication, different innervation, very important. That's something I will definitely be doing. And I'm probably going to do that nugget. I'm going to do the nerve nugget in class because I do want to get the cranial nerves out of the way. And it's a fun thing for me to do a lot and start working on the nervous system as well. 4 pairs, all innervated by the 5th cranial nerve. We'll get into chapter and verse about that. Prime movers of jaw closure, temporalis, and masseter. And really, what you're doing, gravity opens it. The chewing, I mean, it's much stronger. And this is true for very much, not just us, but a lot, but most animals. Basically, the way to control the animal is keeping their mouth closed. Okay, not trying to pull it. It's hard to pull it open. It's relatively easy to keep it closed. Okay, that's really where you see when they. I hate to use the expression, like when wrestling an alligator, where they're trying to control an alligator that's gotten out. They want to return it to the Everglades or wherever. You're gonna you hold the mouth closed and then seal it closed, and you have. I mean, that's what's going to get you. But when those jaws come down on you, you're in trouble. They just don't let go. That's the idea of those type of things. And my dog has a big snout. It would be the same kind of thing with him. It's there. He poodle nosed, please. He's sensitive. And so the temporalis and the masseter, they're the prime movers. The grindings are those pterygoids. It plays a role. It is not a muscle of mastication, period. It's innervated by the facial nerve. It excludes it from that. And then anytime you see the word glossus means tongue. So genio, glossus, that area is sort of the internal portion of the mandible. That's the genio aspect. Hyo means the hyoid bone. It's the only bone that we talk about that we haven't really identified yet. The hyoid is a neck bone that actually forms in muscle. It's an oddball, but really it forms and ossifies, and it becomes basically something for these muscles for speaking and swallowing. And the styloid, remember the styloid process. Okay, that process, that's part of it. Again, we did mastoid, styloid, and zygomatic process. Those 3 processes, the temporal bone. And I do this for a reason because you see them here. And you can go through all of those types of things. So they say the buccinator, facial nerve. So they're correct. Again, an accessory. Think of it as an accessory muscle for chewing, but not a muscle of mastication. So even though they show it to you here, these are the big players. Temporalis and masseter, certainly closing your mouth. And here you can see the pterygoids, medial and lateral pterygoids. And so they're coming in here from the pterygoid plates, and they're going into the jaw itself. So rather than you're going to see some attachments to the interior of the mandible, and probably a little bit into the masseter as well. And then they're showing you these. Now these are a little bit different. They play a role, but mostly for tongue movement. That's there. And again, these are different nerves. So we're involving the tongue. You're going to learn, because we're going to cover it, cranial nerve 12, the hypoglossal nerve. That controls tongue movements, but these are the structures that it's coming from. So you can read through this. It's good. So here you can see it. So genia, sort of the interior of the mandible. Here you can see the styloid process going into the tongue, the hyoid bone, kind of buried and under there. You can barely see it. Here's the hyoid bone, so you can see some of the stuff coming in from it from here, all that type of stuff. And then you see there's all sorts of names. You have thyrohyoid. So there's a lot of little strips named muscles of this massive number of muscles that come in and around this area. But these are not nearly as powerful. They're more purposeful in the sense that they are not just massive protectors and movers and stabilizers. They have to, you move these a lot because we speak and swallow all the time. Some nice pictures. The big player. And so the neck itself is divided effectively into an anterior portion. The sternocleidomastoid comes up diagonally, so coming from your sternum and your clavicle going back behind your ear. So think of that angle anterior to that are the anterior compartment, posterior is the posterior compartment. And then roughly the hyoid subdivides the anterior compartment. And you can go through all of these things, how they push it and blah, 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 blah. And all the different muscles that are there. I don't worry about that. The one that has two bellies is called the digastric. And what's interesting, and so I'm thinking pelican. We saw amazing pelicans down in Cancun dive bombing for fish. Okay, and so it's interesting that it has both it actually has some branches of the trigeminal and the facial nerve. And what it does is sort of, I mean, you have to remember that under your jaw is all soft tissue. And so this forms sort of the basis, and it has two bellies, and you'll see it when it is. And I just thought I'd comment on it. And you can see there's different innervations that are here. And I'm not holding you to know those muscles that are here. But here, for instance, so here's the hyoid, here's the digastric. So you have an anterior belly and then a posterior belly. Anterior from the front, posterior here, the hyoids. And think of this as all that muscular tissue that's underneath there. Here's a very famous sternocleido, and they merge together to the mastoid. Extraordinarily powerful. And then you can see some of these lesser muscles that are in here. Not lesser, but again, they're much more protective, overlying the Adam's apple or thyroid cartilage and protective here. But again, you can see where the naming conventions come from, just structures they attach to. They're there. And these are interesting posteriorly, and you're going to see these are the ninth cranial nerve, the glossopharyngeal, superior, middle, and inferior. All of these are called pharyngeal constrictors. You swallow with them also. Very important. Okay. So they make up the pharynx is sort of like a funnel that's behind your nose, your mouth, and your throat, and it's open anteriorly. Obviously, it has to be for your mouth, but it's in the back. It's like a very strong funnel, and these muscles constrict voluntarily. You control them when you swallow, and basically it's the propulsion to bring food down the esophagus. And it's there, and you can see the distinction here. Here's the hyoid. Then you have the Adam's apple or thyroid cartilage, and right in that same assembly is the epiglottis, and you're going to get the divide into the esophagus posteriorly and respiratorily. The pharynx then divides becomes effectively the trachea at that point. And they're showing you. And then in the back, it's different. I don't go crazy with this. You can read through that if you want. Again, here's a better look at a sternocleidomastoid. And so scalenes, pardon me. Again, coming from the ribs, these are, I think of the muscles that you have to use to tilt your head side to side. All the motions we do with the head will be part of that. Here you can see that when you start splenius, these are coming from the cervical vertebral bodies and inserting into those large prominences, those bony prominences at the posterior aspect of the occipital bone, all those ridges that are there. So you can see the difference between the size and mass of the muscle posteriorly as opposed to anteriorly. And so all these little slips of muscles, whether the semispinalis, as you're going to see, all these different ones in their names, iliocostalis, all these little, I call it interdigitating. They're like little slips of muscles, and there's a lot of overlapping with other muscles. Collectively, they're called the erector spinae. And that's why there's so much complexity in your back with all these muscles that are there. And so you have the iliocostalis and longissimus, and the erector spinae has semispinalis, iliocostalis, and longissimus muscles, and something called the quadratus lumborum. So there's a lot of muscles there, and here you can see a pretty good view. Here's you can see how long they are, and what they're doing is all this movement we have because of all the joints, the motion of the intervertebral disc, and this is what's involved with it. Your back muscles. There's so many of them, and it's interesting when you like my back, and I have to have that basically treated chiropractically every 2 weeks, adjusted every 2 weeks. The way we strengthen is with abdominal muscles because there's so many of these. It's very hard to pinpoint them, but think of it: your back. Basically, it's a combination of the stability from the spine and those muscles, but the best way to strengthen them is the abdominal muscles that really serve to sort of indirectly strengthen them. And it's called Williams flexors exercises. I'll explain them. And so you have all of these. You can see the lung. You see the difference. Iliocostalis here, longissimus here. You don't see a whole lot of difference. Spinalis here, and they all sort of overlap. And then there's that splenius muscle also into the mastoid process. There's a lot of muscles that are there. And this is a view that shows you all of them, how many they are. The quadratus lumborum is bigger than you think. You can see iliac crest all the way down all the way to the floating ribs. Again, stability is there. And then and you have all these different muscles. Ooh. I'm going to stop it here. And I'll probably do another one of these. I hope you find it helpful because after this, and I'll just give you a heads up before I stop. So here we start going into more specific muscles when we start looking at this, just to give you an idea. And so we have to do muscles of respiration. Not hard to do. Look at the diaphragm, really important. And it takes its time going along. And the abdominal muscles. So that'll be the next section. I'll try to get that one done and get that to you as well, because I think they're important. And there's those obliques I was talking about. And I don't do any of those pelvic floor types of things. It depends on where you're going. You may have interest in doing that. And we do the penile muscles and things like that, and more in physiology, and a little bit in anatomy. So let's stop it there. I will endeavor to send this to you, and this is Tuesday the 14th. I'll see you on the 15th. Thank you.